So few question and answer I'm going to discuss, and all of these questions answer are board review questions and related about the basic care and comfort. The first question here, to encourage the adequate nutritional intake for a client with Alzheimer's disease, the nurse should do what? There are four options. You have to choose one. An examiner asking the question about the Alzheimer's disease. And you know, Alzheimer, a type of brain disorder that causes the problem with memory or problem with thinking abilities and behavior problem. And it is a gradually progressive condition, right? So they said, number one, stay with the client, encouraging him to eat. Number two, help the client fit out and his menu and also fill out. And number three, give the client privacy during meal. And also number four, fill out the menu for the client. So if I told you what are the most common symptom of Alzheimer's disease, you must answer me memory loss or forgetfulness. So if forgetfulness or memory loss is the commonest sign or dementia is commonest sign, you easily find out what should be the answer. The correct answer is say, number one, stay with the client, encouraging him to eat. So the first of all, as a RN, it is very important the intervention. Here, the three established an effective way of communication with the patient who have Alzheimer's disease. Alzheimer causes a gradually decline in memory, thinking, and also the skill. And symptom depends on the stage of the disease. So what are the effective communication system with the patient and family? Use short, simple sentence or word and gesture. Maintain a calm and constant approach. Attempt to analyze behavior for the meaning. So we have to follow the therapeutic communication with the patient. What are the rationale? Staying with the client, encouraging him to feed himself well, ensure adequate food intake. Because they forgetful, memory loss, they forget to finish or all kind of food. Nutrition is very important for them. A client with Alzheimer's disease can forget how to eat. Also allowing the privacy during the food or fill out the menu or helping the client to complete the menu does not ensure adequate nutritional intake. So examiner asking about the nutritional intake for Alzheimer's disease. Let me talk about few more important topics about Alzheimer for NCLEX board. The sign and symptom of Alzheimer. Easy way to remember 5A. A stands for patient have a anomia. Anomia means inability to remember the names of things. A stands for Apraxia. Apraxia means misuse of object because of failure to identify them. Also, agnosia. Agnosia means inability to recognize familiar object or inability to recognize the taste, sound, and other sensation. Also, patient develop dementia means memory loss, or aphasia means difficulty of talk, inability to express oneself thoughts or speak. So it is the 5 sign symptom, easy way to remember. Here I said, what are the nursing management? Very important, right? So, or I said the nursing intervention. When we're dealing with the patient who have Alzheimer, it is good to provide a counseling and support to the patient and to the family. Also involve others in patient care, educate how to management the stress or stress management techniques is important to teach them, and also maintenance of personal health for family coping is important. Also give the family information about the expected outcome of the stroke and counseling them to avoid doing things for the patient that he or she can do. Let me read something more from here. So most of the Alzheimer patient is elderly, right? So the chance to fall. So safety is the first priority, or prevention how to fall is priorities. Use the memory aid like calendar, or be patient, or avoid hesitation, or avoid excessive noise and distraction. It is good to avoid conflict. Also, we provide good oral care, prevent aspiration, pneumonia, or good skin care. Also, elimination pattern and problems should be addressed. Means we will find out the problem and give them supportive care, like laxatives for constipation and also fiber to promote the motilities. Here showing few commonest sign and symptom. One more time, I want to recap with you. Loss of memory, problem in abstract thinking. So they do not know, or they forget how to critical thinking. Problem in speaking, reading, and writing. Also, disorientation about or in time and space. Poor or decrease the judgment, difficulty to doing the simple work, difficulty in having elaborate thoughts, or also behavioral change. This is the clinical symptom of Alzheimer's disease. The next question, when developing a care plan who has recently suffered a stroke, a nurse include the nursing diagnosis risks for imbalanced body temperature. What is the rationale for diagnosis? The examiner asking the question, development care plan for a client who has recently attacked by stroke. Actually, the stroke, also known as cerebrovascular accident or CVA. The nurse include the nursing diagnosis and risks for imbalanced body temperature. What are the rationale for this diagnosis? Number one, the stroke may have impact the body thermoregulation center. It decreases the body temperature will signal need to cover the client. A elevated temperature indicate cerebral malfunction, or a elevated body temperature indicate infection. What is the correct answer? It is saying the stroke may have impact the body thermoregulation center. This is number one is the answer. So in this picture, we can see this is the hypothalamus, right? So rationale say the body thermoregulation center are located in hypothalamus. Okay. And a stroke may impair their function. So again, I want to tell you, when a patient attack the stroke, and it is occurred when the supply of blood to the brain is reduced or blocked completely, which is prevent the brain tissue from getting oxygen and nutrient. This is the basic pathology or underlying cause of stroke. So they said a stroke may impair their function because blood supply stopped, nutrition stopped to the brain. A decrease the body temperature is not the necessarily as indication to cover the client. Although the elevated temperature may indicate cerebellum malfunction or infection, this factor are not the focus of the risks described in the nursing diagnosis. So here actually showing how body act during hot or warming response and during cooling response. Before to say a little bit more, I want to share with you the thermoregulator center in hypothalamus. During the warming, our blood vessel constrict, but during the cooling, blood vessel is dilated. During the warming, muscle shivering and thyroid hormone increase the body metabolic rate. So metabolism increase. And what else? During the cooling system, the skin perspirate, sweat gland perspirate, and also we can say that blood vessel dilated. The next question here, and before to go next question, I want to tell you, sometimes NCLEX board asks a question, what are the nursing care about the stroke? It is very important. So when we give the care of stroke patient, always keep it note, we make the care plan or system-based approach to the nursing care. What does it mean? System-based means like respiratory system. We try to prevent of atelectasis or aspiration pneumonia. This is the first priorities. Then we go for neurological management, like we go for follow the neurological scale. Safety is important. Then go cardiovascular system, means assessment of dysarrhythmia or how to prevent deep vein thrombosis or DVT prophylaxis is important. Then we go for musculoskeletal system, means maintaining optimal function, right? Also, motion exercise or positioning is important. Then we check for GIT, means prevention of constipation, or also elimination of the bowel. Then we check for genitourinary system, right? Prevention of skin breakdown. Very important when we deal with the stroke patient. And here question, which client statement indicate a good understanding of a nutritional modification needed a manage hypertension, right? So number one, a glass of red wine every day will lower my blood pressure. So red wine can reduce the bad cholesterol, not a blood pressure. Number two, I should eliminate the caffeine from my diet to lower my blood pressure. But examiner do not say how much caffeine you take, because if you take very mild caffeine, it does not has any effect on your blood pressure. But if you take too much caffeine, very, I mean, huge amount, that can cause. And number three, if I include less fat in my diet, I will lower my blood pressure. If I include less fat, right, in my diet, I will lower my blood pressure. Number four, limiting my salt intake to the 2 grams per day will improve my blood pressure. So what are the most priorities out of 3 and 4? The correct answer said it is good to take less salt, right? That is important for your body. So high blood pressure, so how we control high blood pressure? Non-pharmacological way, right? So simply lifestyle change can regulate high blood pressure. But when blood pressure is very high or lifestyle measure is fall, that times medication is very important to control the blood pressure. In this picture, we can see some good food that is basically is good for your heart, right? So what are the good food or nutrition in this picture? Showing some salmon, yogurt, or sunflower seed, and or also white beans and potatoes. So good food to eat and prevent the blood pressure, right? It is good if we eat more fruits, vegetables, or low fat dairy foods. Okay. So also it is good to avoid the frozen food, salty food, sugary food, or red meat. So rationale. To lower the blood pressure, a client should limit daily salt intake to 2 grams or less. Alcohol intake is associated with higher indicate of hypertension, poor compliance with treatment, and also refractory hypertension. Chronic moderate caffeine intake and fat intake does not affect the blood pressure. Next question here. Which action is contraindicated for a client who develop a temperature 100 or 2 degrees Fahrenheit or 38.9 degrees Fahrenheit? Number one, monitoring his temperature every 4 hours. So examiner asking what is the contraindicated. So monitoring blood pressure every 30 minutes is good, every 2 hours is good because vital sign is not stable. But if you monitor every 4 hours, it is not good, but it is not a contraindicated. Maybe your agency policy say go for 30-minute interval, go for 2 hour interval. But if you follow 4 hours, it is not a contraindicated. Increase fluid intake. It is not a contraindicated. Fluid intake is good if you have a high fever. Covering the client with a light blanket. So maybe you need heavy blanket, but light blanket, good or bad, it is not a question, but it is not a contraindicated, right? So remaining is number 4. It is the answer. This is the one way we can choose the answer, right? Number 4, I'm not sure, but I'm sure number 1 is not an answer. Number 2 is not an answer. Number 3 is not an answer. So I choose number 4. Another way, let me explain. When body temperature is go up or fever, our metabolism rate is go up. When metabolism go up, we need high calorie food, but they said provide low calorie food. So it is not a good choice if body temperature go up. So what are the correct answer? They said contraindication is providing low calorie. Why? Because the client with a fever has increased the basal metabolism rate, he needs additional calorie in his diet and not few calorie. Monitoring the client temperature, increase his fluid intake, and covering him with a light blanket are therapeutic intervention for a fever. In this picture, we can see healthy, high-calorie foods, right? The list of like avocado, eggs, then white milk, chicken, banana, dark chocolate, yogurt, cheese, salmon, also beans, potatoes, nut, tofu, olive oil, and oat. They contain high calorie, also a good source of fiber. Next question here. A nurse is planning care for a client with a pressure ulcer. Which statement should the nurse include the client during care of plan? So select all category question, right? And question talking about the pressure ulcer. So if I ask you, what is pressure ulcer, right? Pressure ulcer, also known as bed sore, or also called pressure ulcer and decubitus ulcer. Pressure ulcer are the injuries of the skin and underlying tissue resulting from prolonged pressure on the skin or prolonged immobilization. Whatever. The examiner asking which statement should the nurse include in client nursing care plan. Number 1, use pressure reduce device. It is okay. It is good choice. Increase the carbohydrate in the diet. Oh, this is not a logical point. Increase carbohydrate for the pressure. Increase protein is good. Protein can help to healing the pressure ulcer, not carbohydrate. So next here we said reposition every 1 or 2 hours. Very good choice, right? So reposition increase the blood supply and you can prevent pressure ulcer. Number 4, teach the family how to care for a wound, right? Logical. Number 5, clean the area around the ulcer with a mild soap and water, not alcohol. Good choice. Avoid the use of supportive surface therapy. Why you should avoid? No need to avoid. So what is the correct answer? They said number 1, use pressure reducing device. Number 3, reposition every 1 or 2 hours. Number 4, teach the family how to care for the wound. Number 5, clean the area around the ulcer with a mild soap. Rationale: use a pressure reduced device, reposition every 2 hours, and cleaning the area around the wound with a mild soap will aid in the healing or will prevent the further skin breakdown. And teaching the family how to care for the wound will assist with discharge the planning. Protein, not the carbohydrate, intake should increase to promote wound healing. Support surface therapy is a major therapeutic method for managing the pressure, right? So in this picture, we can see the different stage of pressure ulcer. So here we see stage 1, we call persistent redness on the skin. So you see only red. So no blanchable, no erosion, intact the skin. Maybe little discolor of the skin. If you touch, you can feel this is little bit hot or warm. Maybe edematous, right? Or sometimes hardness. Okay, this is the stage 1. And stage 2 or grade 2, the formation of bubbles, this one. So the stage 2, we see the partial thickening skin loss involving epidermis or dermis or both. And stage 2 or grade 2, the ulcer is superficial and presents clinically as an abrasion or blister or bubble. Number 3, damage on the skin here. So number 3 or stage 3 or grade 3, the full thickness skin loss and involve the damage or necrosis of the subcutaneous tissue that may extend down to, but not through underlying fascia or structure. When number 3 is get involved the underlying structure, we call stage 4, where the skin necrosis. Grade 4 or stage 4, extensive destruction occur, or tissue necrosis occur, or damage on the muscle, bones, or supporting structure with or without full thickness skin loss. So here are the 4 steps of or stage of ulcer. In this picture, we can see if anybody is lie down for a long time, does not move, they have a chance to develop the ulcer, pressure ulcer. And pressure ulcer here, but if we use the device, say use the pressure reducing device. This is the pressure reducing device. And now next question. A nurse is give a client 325 milligram aspirin suppositories. The client has diarrhea and is in the bathroom. The best nursing approach at this time would be. So this here the question we are going to learn today. If anybody have a diarrhea, do you give them suppository or not? And you know, suppository is a solid medical preparation to be, it is designed to be inserted into the rectum, or sometimes we use the, I mean, in other organ like vagina. So number one here, administer the suppository 15 minutes after the diarrhea stop. Number two, withhold the suppository and notify the client physician. Number three, tell the client you will give him suppository when he is finished in the bathroom. And number four, substitute 325 milligram aspirin by mouth. So what is the best option? Number two, withhold the suppository and notify the client physician. So rationale said, because the client has diarrhea, the nurse should hold the medication and talk with physician. And she should never give a suppository to the client with diarrhea, because the client should expel the suppository. Waiting 15 minutes or until the client is finished in bathroom is inappropriate, because the client will most likely have another urge to defecate and will expel the suppository. And also substitute the oral form. Oral form is inappropriate, right? Only the physician can change the administration, the route of the oral dose. Here we discuss few board review questions for NCLEX board exam, but every student must know.